I think the important thing is we need to understand two areas. One is, what is the true impact of these infections on the individual travel, the average individual healthy traveler? How long do they hold it for? What are the health consequences of that? We also need to say we understand how the traveler fits in the bigger picture of local community emergence and sustainment of antimicrobial resistance and global spread. There's lots of sources of antimicrobial resistance spread. The traveler can play a role in that, but we don't fully understand. And so we need to do studies which help us balance or understand the balance between helping a traveler out who gets sick when they're on vacation or on a mission and the resistance spread globally that this acquisition might have. So I think that's the big picture of what needs to go next. I think what we're interested in doing is designing a clinical study that really might understand this, and so looking at placebo, single-dose regimens versus multi-day dose regimens of the same drug in the same place, and look to see. We believe strongly that there's a dose effect, and so if you can minimize the dose of antibiotics that you use while you travel and get the same therapeutic effect, of stopping your traveler's diarrhea, then we should be doing that. And so we need more evidence to say that single-dose antibiotics work, which we have that evidence, but it doesn't induce this acquisition that we're seeing with these multi-day dose regimens. And so those are the next areas of research that we'd like to pursue. I think that another area would be, what's interesting is people that acquire these multi-drug resistance organisms, we need to be able to screen them and then also get rid of it. And so I think there needs to be more emphasis and research in looking at decolonization, and that would be very helpful among not only travelers returning but also hospitalized patients that may be colonizing MDR, and reduce the major problem of antimicrobial resistance that we're facing.